Good morning, everybody. How many people here took the 10? Oh, good. That was smart of you. Okay. So my name's Janet Pregler. I'm the director of the Iris Cantor-UCLA Women's Health Center, and I'm really thrilled to welcome you here to our Lesbian and Bisexual Women's Health Conference for 2019. This event was made possible due to the financial support of the County of Los Angeles, Department of Public Health, Office of Women's Health, and our conference will emphasize mental health and substance-related disparities faced by lesbian, bisexual, and queer women. These conferences, I think, need to happen. We had a wait list of over 200 people who unfortunately we could not accommodate today, but this forms a group that we'll be able to continue to communicate with and work with. Now, I've been director of the Iris Cantor Center for over 20 years. I've been really fortunate to be part of many convenings, but I'm going to tell you that this convening to me is very special because never before have I been able to offer to an audience of advocates such a clear action that they can take to impact the area that we're talking about. And I'm going to tell you what that is. And I'm also going to read it because I've been told I have to read this so I don't goof it up. Okay, so here we go. A major step is being spearheaded by the LA LGBT Center and a broad coalition of LGBTQ organizations, health providers, governmental agencies, coalitions, community organizations, and advocates. And again, I suspect many people in the room know what's going to come next, who have developed an $18 million budget request to present to the legislature to fund and operationalize the efforts of the LGBTQ Women's Health 2019-2020 budget proposal. This is aimed at decreasing health disparities for LBQ women in California. And this is something that I hope you will consider and decide whether it's something that you can support. Just last month, a team went to Sacramento and met with the Senate and Assembly Budget Health Subcommittees, the LGBT Caucus, and the Governor's Office. Because of the interest in the proposal, the team again went to Sacramento 2 weeks ago, where the proposal was heard by the Senate Budget Subcommittee on Health and Human Services. And again, I'm a doctor, not a legislator, but I've learned over the years how long it can take for a proposal like this even to get a hearing. So the fact that this is moving forward so quickly, I think, shows that it in fact does have a lot of support and is something that is possible. In May, the Assembly hearing will be held to decide on the funding. The next few months will be critical in securing the necessary support to ensure that this funding proposal becomes a reality and we can take significant steps toward ending health disparities and barriers for LBQ women. If you are interested in supporting this, please stop by the LA LGBT Center table to fill out a postcard and find out more how you can be involved. So again, I just want to thank the LA LGBT Center and everyone in this room who's been part of this proposal, and I'd like to take a minute just to recognize them. Now, as I think all of you know, these sorts of events don't come together without the work of a tremendous number of people. And I do want to recognize our LBWHC Steering Committee roster for 2019. Everyone that works on this, I think, is quite humble. But please, if you're here when I say your name, please raise your hand, or if you can, stand up so that people can recognize and understand, as an example, if they might want to network with you later over the course of the day. So our members include Allison Cerezo from the University of California, Santa Barbara. Yay, Allison. Amy Cummings, MD of the David Geffen School of Medicine at UCLA. Farina Yasmandari, RN, Pathways by Molina. Allison Diamant, MD, MSHS, David Geffen School of Medicine at UCLA. Ellen Idem, Office of Women's Health, Los Angeles County Department of Public Health. Bobby Emitu, PhD, MLS, MPH, California State University, Northridge. Julie Friedman, MPH, CHES, Iris Cantor-UCLA Women's Health Education and Resource Center. Abby Land, Los Angeles County Women and Girls Initiative. Sue Lavacare, MA, Health and Wellness Consultant. Anji Magana, NP, LA LGBT Center. Corey Plank, City of West Hollywood. Myself. April, thank you. April Soto, MD, AA-HIVP, Kaiser Permanente. Elaine Serrani, Dignity Health, Glendale Memorial Hospital. Claire Thomas, DO, Kaiser Permanente, West Los Angeles. Megan Treese, RN, Dignity Health Medical Foundation. And Robin Watson, RN, MN, CNS, CCRNK, Los Angeles County Department of Health Services. I also want to acknowledge our conference co-sponsors, and these are all organizations that have had a deep commitment to women's health and to the health of lesbian, bisexual, and queer women. This includes the Iris Cantor-UCLA Women's Health Center Executive Advisory Board. This group, for over a decade, has basically underwritten whatever it is that we couldn't find money for. So I always tell people, if you like your muffin, thank the members of our Executive Advisory Board. And I specifically want to thank Mr. Ryan Fisher, who's the Executive Director of the Iris Cantor Foundation. I don't believe he's here today, but he's been an incredible advocate for women's health and also LGBTQ health, and many of you in the room may know him. Also, the City of West Hollywood, who supports our efforts, the UCLA Center for the Study of Women, the Human Rights Campaign Foundation in Washington, D.C., and the LA LGBT Center. It's my great pleasure now to introduce my mentor and someone that I have admired for so many years, which is Ellen Idem, Director of the LA County Department of Public Health's Office on Women's Health. Over 10 years ago, she took the step to convene over 400 advocates in LA County to set an agenda for women's health. So this did not come from the top down. This came from community experts who knew what the priorities should be. One of the priority areas at that time was identified to be lesbian and bisexual women's health, and today's conference is one of the culminations of that effort. So please welcome Ellen Idem.
Good morning, and welcome. We know this room is going to be very full in the next few moments. The health of lesbian, bisexual, and queer women is critical. 1 in 2 lesbian, bisexual, or queer women experience discrimination in the health setting. 1 in 3 believe disclosure of their sexual orientation to their physician would adversely affect their health care. Less than 10% of lesbian and bisexual women have been asked by their physician about their sexual orientation. Less than 10%. Nearly 30% put off seeing a doctor even if they have insurance. So again, welcome. We're very pleased that you're here. This is our 4th Lesbian and Bisexual Women's Health Conference. Our first 3, similar to today, were geared toward healthcare providers, administrators, social workers, health educators, public health advocates, and various healthcare staff and professionals, focusing on the healthcare needs in the lesbian, bisexual, and queer women's community. All of it with the goal of creating inclusive and culturally responsive policies and procedures, promoting better access to health care, equitable and respectful service delivery, and awareness of the health issues that lesbian, bisexual, and queer women face. It's addressing both, what we try to do is address both the individual needs of these women, but also for improving the institutions and the systems overall. So in addition to the various conferences that we've had in the past three-ish years, last year in 2018, we offered 13 individualized lesbian and bisexual women's health trainings, serving about 250 staff in a variety of settings that included things like hospitals, women's jail, academic settings, health plans, and CBOs. As Janet mentioned, the lesbian and bisexual women's health was identified at the 2007 LA County Women's Health Policy Summit. And simultaneously, the City of West Hollywood, they had a group called the Lesbian Visibility Committee, and they adopted at the time what was called the Lesbian Health Bill of Rights. And we worked cooperatively together and brought together key stakeholders in the lesbian and bisexual women's health community, which later evolved into, in 2009, we evolved into the LA County Lesbian and Bisexual Women's Health Collaborative. And we have remained committed to health equity for lesbian and bisexual women in LA County. And as Janet mentioned, members represent both healthcare facilities, government agencies, community organizations, and academic institutions with experience advocating for the health and well-being of lesbian and bisexual women. So one of our key priorities that we've worked on for several years was to develop an LA-based culturally competent curriculum and that was on lesbian and bisexual women's health that we could take out to healthcare professionals, to lay staff, and to health administrators. So the goals for today's conference include, and you'll hear a variety of information about this, promoting various research, supporting community advocacy, increasing cultural competence, promoting public policy, addressing the intersection between mental health and substance use, and ultimately improving the health and health status of lesbian, bisexual, and queer women. This year, we're offering a choice which you all signed up for, workshops focusing on either legal, regulatory, and compliance issues, or social service supports access and accessing community-based organizations, or ensuring care for the trans community. So our lunchtime panel, we're very fortunate to have 5 dynamic clinicians giving us a variety of perspectives on caring for lesbian and bisexual women and addressing the healthcare disparities that they face. You're going to hear more details in a moment, but we want you to know that you too will be able to request a free training tailored to your agency or facility to raise awareness and to ensure your organization is going to do everything possible to be able to create a work environment that's as culturally responsive as possible and welcoming to lesbian and bisexual women. So in addition to kind of offering these trainings, which again, it'll be in your packet and you'll be able to sign up for, we'll also be holding a Train the Trainers workshop so that you too could become a champion and to be able to get further steeped in issues and solutions for lesbian, bisexual, and queer women. So again, I want to thank you all for being here today, and I'm now going to introduce our plenary speaker. I won't be reading her job description, or excuse me, her job, who she is, I should say her bio. It's in your packet. Her name is Christy Mallory. I'd like you to all welcome. She's the State and Local Policy Director who oversees the state law and policy work at the Williams Institute at UCLA School of Law. So will you help me welcome Christy, who's coming up? And just to say that at the end, She's going to speak at the end. She's going to take questions both by mic and on the cards on the table. So if you have questions, please feel free to write them down on the card, and there'll be plenty of time for questions. Welcome, Christy.
Hi, everyone. While I'm getting this set up, I can. Does anyone know how to do a presenter view on here? Okay, we're just going to go with this then. Okay. Hi, everyone. My name is Christy Mallory. I am the State and Local Policy Director at the Williams Institute at the UCLA School of Law. How many of you have heard of the Williams Institute before? Oh, great. So I hardly need an intro, but I will give them for those of you who didn't raise your hand. So we are an interdisciplinary organization at the UCLA School of Law, and we are exclusively focused on research on LGBT law and public policy. We've been around for 18 years now, and we engage in a variety of different research and outreach strategies in order to bring awareness and change policies that affect LGBT people. So as I said, we are an interdisciplinary organization. We're housed at the law school at UCLA, but we're made up of experts in a variety of areas, including law, public policy, public health, demography, psychology, and economics. And we're always expanding and looking for other experts. So if you're interested, please check us out more. And we do research in different areas, including demographics, public health, public policy. And every year, our experts, as well as other experts in the field, come together. So this is a shameless plug to come to our conference if you want to do this again in a few weeks and hear our speakers talk to you about issues impacting LGBT people at the federal and state level. Come find me after if you'd like to come. I have some hard copy invitations I can hand out, or find us on our website. So I want to talk a little bit about what we know about lesbian, bisexual, and transgender women to begin with. So I'm really excited about this because this is the first time I'm actually able to talk about this brand new data we have. You're the first people to see this in a presentation, which is thrilling for me. So I'm going to talk about the strengths and what we know from this data, and then I'm going to talk a little bit about the limitations to get you all thinking about what we can do to better collect data on specifically lesbian, bisexual, queer, transgender women in the state and nationwide. So again, this is brand new data from the Gallup Daily Tracking Poll. It's one of the biggest data sources for LGBT data. As I'm sure you all know, the census does not ask a question, or the American Community Survey, which is the longer form census. That's done on a smaller number of households every year. Neither the census nor the ACS asks people about their sexual orientation, gender identity. So really all we can measure from the census is same-sex couples. So Gallup, of course, is a privately run survey. It's not a government survey, but they have added a question about LGBT status. That's the great news. The bad news is the question, has anyone ever gotten a Gallup Daily Tracking Survey? Oh, there's one, great. So as I'm sure you know, the question is, basically, do you identify as LGBT? It is one group lumped together. We are working with Gallup to better break up the group of respondents who say, yes, I identify as LGBT, specifically, and to look at people who identify as transgender. Again, the Gallup does ask questions about gender, so I'm actually able to isolate in this data people who said, yes, I identify as LGBT and I also am a woman, but that's the best I can do. I wish I could do more, but I'm going to present to you some data on people who answered those two questions. Yes, I'm LGBT. Yes, I'm a woman here today. So first, these are the percentages of the female population identifying as LGBT nationwide. So you see the highest percentage there in Oregon, and nationwide it's about 5.1%. We also know that about 60% of the LGBT community as a whole is also a woman. So there are more women represented among LGBT people than men in general. And you see that even specific states too, there are more women identifying as LGBT. So California ranks 9th here with 5.4% of the female population identifying as LGBT. And we see similar concentrations of men by state. So if I were to show you the slide about people who said, yes, I'm LGBT and a man, it would look similar in terms of shading. So you may notice here that the darkest blue states with the highest concentration of LGBT women also tend to be the states with the most supportive legal and policy environment for LGBT people. There are a few exceptions though. Of course, Indiana is a very notable exception there in the Midwest. Of course, we know of Indiana from their religious bill that was quite hostile toward LGBT people a number of years ago. We all know that effort. And then maybe some surprises in the South too, with a few southern states that aren't usually thought of to be friendly to LGBT people, like North Carolina, for example, having high concentrations of LGBT people as well. So in terms of race and ethnicity of people who identify as LGBT and female in the Gallup data, we see that they are pretty diverse. This is a breakdown by race and ethnicity. Again, we're limited to the race question on the Gallup Daily Tracking Survey, which only asks about these race categories. This is nationwide. So this, again, there's a similar breakdown for LGBT men, but nationwide, LGBT women are more diverse than non-LGBT women. And we're also able to look at data specific to California from the Gallup poll. So you can see here that LGBT women in California are even more diverse. And if I quickly flip between these two, you can see there that LGBT people in California, LGBT women in California differ most notably from the US slide in that they are more likely to be Latina and less likely to be white or black. And so this is what we also see in the non-LGBT population in California. So this actually tells us a lot. This tells us that LGBT, and we see a similar pattern in other states. So this really tells us that LGBT people are living in communities that look like them in terms of personal characteristics that aren't sexual orientation and gender identity. They're living in communities that look like them in terms of race. We also know they're living in communities that look like them in terms of child rearing rates. So there aren't these sort of LGBT meccas on the coast that we thought for a long time before we had access to this kind of data. We're also able to look at educational attainment of LGBT women in the Gallup data. And you can see there that educational attainment is very similar for LGBT and non-LGBT women nationwide, slightly less likely to have a bachelor's degree or a postgraduate degree nationwide. Those differences disappear in California, even smaller. So essentially, education looks the same. This is important to remember in a few minutes when we talk about other types of socioeconomic disparities impacting LGBT people. So we can also look at the age distribution of women with the Gallup data. We know that younger women and younger men are much, much more likely to identify as LGBT. So that's what we're seeing on this graph here. You can see that of 18 to 24-year-olds, 35% of the LGBT community falls in that age bracket. That is huge. Another 29% of the LGBT female community falls in the 25 to 34 age bracket. This means that over 60% of LGBT women in the US are under age 35. By comparison, only 26% of non-LGBT women in the US are under age 25. That's a huge difference. That's where you're seeing that. This graph looks very similar for men who said that they identified as gay, bisexual, or transgender. You can also see there that the average age at the national level is about 15 years younger for LGBT women. And unsurprisingly, we see a similar pattern in California, with about 60% of LGBT women under the age of 35 compared to 30% of non-LGBT women. And again, average age is about 12 years younger for LGBT women. We also have data on people raising children. So we know from Gallup data, this is among people who are 25 or older. The Gallup question on raising children isn't great. It doesn't ask whose child or how you're related to the child. It asks about a child in the household. So we have looked at people aged 25 and above in order to take out situations where people may be living with a younger sibling who's still a minor, and they'd have to answer that the person is in the household, but it's not their child. So among LGBT women aged 25 and older, we see nationwide that about 40% are raising children. In California, about 34%. So oftentimes when we talk about LGBT people raising children, at least for me and probably for many of you, your mind kind of automatically goes to same-sex couples. We think we're seeing female same-sex couples here. The Williams Institute is currently working on a follow-up study that shows that LGBT women and LGBT men are actually raising children in a wide range of family structures. There are many single LGBT people raising children, single people who have never been married or coupled. There are many, of course, LGBT people raising children with a same-sex partner. There are many LGBT women raising a child with a different sex partner. And there are also, of course, widowed and divorced parents raising a child on their own or with the help of other family members. And we also know that these families are formed in a range of ways, whether it's through adoption or fostering, which is much more common among same-sex couples than different sex couples. We know, of course, that people use IVF and other assisted reproductive technologies, and we know that second parent adoptions are also fairly common. And as I mentioned briefly before, we also have some data on the socioeconomic outcomes of LGBT people and non-LGBT people in the Gallup data. So this is showing you 4 different measures: those who live in a household with an annual income of less than $24,000 a year, people who are food insecure, people who don't have health insurance, and people who are unemployed. Again, this is just a slide of LGBT women. You see some disparities there, most notably in those who say that they have experienced food insecurity within the past year, and those who say that they have a household income of less than $24,000 annually. We see, of course, a similar sort of pattern in California, but those gaps narrow a little bit, actually quite significantly on most measures, except for maybe food insecurity. So we're seeing those flags move closer and closer together, which is probably reflective of the supportive legal and policy landscape in California, as well as just more social acceptance and a more supportive social climate. That said, the most important takeaway that I don't actually have a separate slide on here, I'm sorry, is that these flags are all much further to the right than they are for men, whether they're LGBT men or non-LGBT. I wish I could show you that. I didn't include it, but please check out our website. So again, LGBT women in California are doing pretty well, but compared to men, they're not. Those flags are all further right. So now I want to shift from talking about the data to really looking at laws and policies that affect lesbian, bisexual, and transgender women's health. And I'm going to frame this part of the talk in terms of how we've identified certain needs through research, and then how we've moved towards solutions through law and policy at both the federal and state level. So let's start with the big one, which is the need for sexual orientation and gender identity non-discrimination protections in healthcare. So I want to start by talking about the need for robust and consistent protections for LGBT people in healthcare. Of course, non-discrimination protections are really important across the board, whether that's in employment, housing, education, credit, but they're really important in terms of healthcare because we see these huge disparities, and health is so important, and healthcare access is so important. And we know that the ACA has made a big difference in terms of getting people insured. But as you saw, those flags were still a few bars over, so not everyone is insured. So I'm going to review some data that I kind of put together for this slide. This is just sort of to give you a sense of what's happening in terms of discrimination. This is certainly not all that's out there. There's been a lot of research done in this field, and I'm going to focus on studies done over the past decade that both show discrimination in healthcare and health outcomes that negatively affect LGBT women. So this is a study done by Lambda Legal, and they found that LGB as one group and transgender people experience discrimination in healthcare, as well as people living with HIV. Unfortunately, the study did not break the data down in terms of sex, so I'm only able to show you this as a group. Just as a note going forward, I will break down the data where I'm able, but sometimes I'm just not. So this is a nationwide study. You see that about 10% of LGBT people reported that healthcare professionals used harsh or abusive language with them. And about the same percentage reported that healthcare professionals refused to touch them or used excessive precautions when treating them. Most interestingly, you can see here is that the percentage of transgender people reporting discrimination is so much higher. We're going to see this over and over on these slides today, and this is not unique to the healthcare context. Of course, when we get into talking about laws and policies, much of the action recently has been around providing transgender people care, which in this data really highlights that that is where the biggest need is at the moment. And again, this is not specific to healthcare. We see this in employment, housing, public accommodations, much higher rates of discrimination reported by transgender people. So this data is from a nationwide study done by the Center for American Progress last year, and also found high rates of discrimination in healthcare. So the last survey that I showed you from Lambda Legal asked people about discrimination experiences over their lifetime. This is people reporting discrimination just in the past year. And again, this is a very recent study. When we think things are getting better, laws and policies are getting better, social acceptance is higher, yet we still see high percentages of people reporting discrimination. Alarmingly, there almost 30% of transgender respondents said that a provider had refused to see them within the past year. So the Center for American Progress survey also asked respondents whether they would be able to find a similar service if they were refused care. This is really trying to isolate not only a problem with discrimination, but look at what the impact of religious refusals could be in terms of people getting the care they need. If you got turned away from this hospital, yeah, I mean, people say there's other hospitals, there are other clinics, there are other doctors, but is that really something that's people can go find the other service as easily as they make it sound? Not to trivialize the bakery case or that situation, but there is a difference between needing health care and being able to find it and having to go somewhere else versus maybe having to go get a different case. It's much more dire in this situation. So you can see here that the Center for American Progress broke down their data in terms of people living in metro areas and people living in rural areas. The people in rural areas, not surprisingly, said they'd have more trouble finding the service at another provider. This is particularly troubling given that urban areas are generally more accepting of LGBT people and have better laws and policies in place. So we're seeing here that the people who need these protections most are, the ones that don't have them. Oh, sorry, my percentages aren't showing up there, but basically, you get the idea. When we look at women in California, this is data from the California Health Interview Survey. Again, California, as we all know, has a very supportive social climate and legal landscape for LGBT people, which probably helps reduce disparities. But you still see that lesbian and bisexual women are more likely to say that they've experienced unfair treatment when getting health care than non-LGBT women. We also see that particularly bisexual women in the CHIS data are more likely to say that they had trouble finding specialty care and primary care to some extent. The specialty care disparity is quite a bit higher between bisexual and heterosexual women. So we know that, again, from this data, which is limited, we're limited in terms of how we can separate out bisexual women. But we know from other studies that generally look at the LGBT population that bisexual women have particular hardships and experience even greater disparities sometimes than LGBT women. So now I want to move from talking about the need for non-discrimination protections in healthcare to looking at what movement has been made toward expanding protective laws and policies at the federal level. So a huge game changer for healthcare at the federal level was, of course, the ACA. And very importantly, the ACA includes a provision that prohibits discrimination based on race, national origin, age, sex, and disability in healthcare. As you can see, the statute does not explicitly prohibit discrimination based on sexual orientation and gender identity. But that does not mean that LGBT people are without protections under the law, and that is because of how the term sex has been interpreted by courts and formerly HHS. So back in the spring of 2016, the Office for Civil Rights in the Department of Health and Human Services, which is charged with implementing that non-discrimination provision in the ACA, they interpreted the sex non-discrimination to also prohibit discrimination based on gender identity and based on sex stereotypes. So many of you are probably familiar with the case Price Waterhouse, which was a case decided by the Supreme Court in the late 80s that said that discrimination based on one's nonconformity with gender stereotypes, the stereotypes associated with their sex at birth, violated the sex non-discrimination provisions of Title VII, the Federal Employment Non-Discrimination Statute. So that really opened the door for a lot of LGBT people to bring claims of discrimination that were maybe thrown out before, but it was not a decision that LGBT people were per se protected from discrimination based on their sexual orientation or gender identity. Courts, the standard differed a little bit depending on where you were in court, but courts still required you to show that evidence that the discrimination was actually based on sex stereotypes and not just saying I'm gay or I'm transgender, and that's why my employer didn't like me. So we've seen the law evolve there. Many more courts are accepting complaints from people that are LGBT. Back sort of after the Price Waterhouse case was decided, a lot of courts were sort of throwing out these cases brought by LGBT people on the grounds that this discrimination, this sex stereotyping discrimination case could not be used to bootstrap protection from sexual orientation discrimination onto Title VII. They really were saying that there's a difference here. Courts are now sort of seeing LGBT discrimination as per se sex discrimination in a lot of cases, happening more and more. And that's especially when it comes to discrimination against transgender people. So when this rule was issued back in 2016, a number of federal appellate courts had already held that discrimination against transgender individuals is per se sex discrimination. And they relied on a few different rationales there, similar but related reasons for saying that. But it all sort of stemmed from this idea that being transgender, said by some courts, is in itself a failure to conform with society's expectations of what someone of a certain gender should act. So that was a convincing argument for many courts. But as you'll see, the rule did not include sexual orientation in terms of sex. It did not interpret the sex protections to extend to discrimination because someone is lesbian, bisexual, or gay. So that was now a few years ago. More and more courts have been accepting that argument for similar reasons, that it is a form of sex stereotyping. As some courts have said, it's the ultimate form of sex stereotyping to expect someone who is a woman to partner only with a man, or vice versa. But at the time, the rule did not include sexual orientation. So as soon as HHS issued this interpretive regulation, it began accepting complaints of discrimination on the basis of gender identity and nonconformity with sex stereotypes. But as we'll talk about in a second, it only took action to enforce these complaints for a few months. So the Center for American Progress gathered the complaints filed during those few months and looked at on what basis people were alleging discrimination had occurred. And you'll see here that the most commonly reported form of discrimination was that patients were denied care because of their gender identity, followed by reports that patients were misgendered or a healthcare provider used derogatory language toward them. So most alarmingly here, I just want to point out, in case you can't read it on the slide, that big piece of the pie, the 24% there, is people saying that they were denied care because of their gender identity and they weren't seeking transition-related care. They were seeking some other form of care. They happened to be transgender and they were turned away because of that. So as I said, there was only a small window of time that HHS was actually enforcing the rule issued under Section 1557. And that's because the rule was challenged in court by a religiously affiliated healthcare alliance that argued that the rule was too far outside the bounds of what the statute allowed and that it violated the Religious Freedom Restoration Act by placing too substantial a burden on their religious exercise because it made them provide care to transgender people in part. So the plaintiffs, the Healthcare Alliance in that case, asked for an injunction against the rule. The judge granted that injunction, which meant that enforcement of the rule was put on hold pending a full trial on the merits. That decision came down on December 31st, 2016. We all know what happened in January of 2017. So HHS has followed that injunction and will not enforce the rule. So, and they have declined to appeal the injunction as well. But that said, all hope is not lost, even if that rule is overturned by the new administration or if a court finds it invalid. And that's because Section 1557, again, that's the provision we looked at the beginning, the non-discrimination provision. That law provides a private right of action. So this means that individuals don't have to depend on HHS to enforce their rights. They can go directly to a court and have those a judge determine whether they've experienced discrimination in violation of the statute. So as I've mentioned, this argument is gaining a lot of traction in courts, particularly in the Title VII employment non-discrimination context where it sort of began, and it's been similarly interpreted and useful in the Title IX context, particularly where students have alleged that they have been denied access to restrooms consistent with their gender identity, and courts are beginning to say, oh yeah, that's a form of sex discrimination. And now we're also seeing courts interpret that 1557 language to independently prohibit discrimination based on gender identity. 4 cases there, there are probably others. These are just a few I pulled out, recent decisions. Again, these courts are saying we don't have to rely on that HHS interpretation. It doesn't matter what the federal government, what the agency is saying about what this rule that they implement means. We're going to look to the statute, and we think the word sex in there is broad enough to prohibit discrimination based on gender identity. And we expect to see many more of these cases come up and cases alleging discrimination on the basis of sexual orientation in violation of Section 1557. So California has a great non-discrimination law on public accommodations that applies to hospitals and clinics and other healthcare settings. I won't go into this too much, but I just want to basically say here that, you know, the ACA's protections, the Section 1557 protections, aren't as important in California as they are in the majority of states that lack laws like this that prohibit discrimination based on sexual orientation and gender identity in public accommodations. There are 29 of those states without these laws right now. So now I want to talk a little bit about California state laws and policies, and specifically ones that go beyond basic non-discrimination protections to improve LGBT people's health and access to health care. And I especially want to focus on some particularly vulnerable subpopulations like transgender people, youth, and older adults, where California in the last few years has made great strides to improve health and healthcare access. So first I want to look at the need for protections and access to restrooms. So this is data from the U.S. Transgender Survey, which is the largest survey of transgender people conducted to date and done by the National Center for Transgender Equality. And this survey found that transgender people are experiencing discrimination in accessing restrooms consistent with their gender identity, and that they're experiencing some pretty serious negative health impacts of those either being refused, discriminated against in terms of restroom access, or in terms of feeling like they have to avoid going to a public restroom, this kind of thing. People have reported urinary tract infections, kidney infections, and other kidney-related problems as a result of discrimination or fear of discrimination. So one of my colleagues at the Williams Institute, Jody Herman, found similar results in a survey she did of transgender people in DC. Her survey found that an alarming number, nearly 60% of transgender people surveyed, reported that they had been verbally harassed in restrooms, and significant percentages also reported that they had been denied access or even sexually assaulted in restrooms. Just like the USTS survey, Jody found that people reported health problems as a result of either not being able to access restrooms or because they feared discrimination if they tried to access restrooms. She realized that people were actually shaping their lives around this fear, that they were avoiding going out in public spaces. And for some, this even had a negative impact not only on their health, but also in their employment and in going to school and basically participating in everyday life. So California recently, California's taken a few steps towards making restrooms safer and more comfortable spaces for transgender people. So first, there are laws like the public accommodations law we just looked at, and one specific to students, that ensure that transgender people can use restrooms consistent with their gender identity in public accommodation. And then in 2017, the state legislature went one step further and passed a law requiring that all single-stall facilities in places of public accommodation, including hospitals and clinics, have clearly marked gender-neutral or all-inclusive signage. So this should be everywhere. If you go to a restaurant and don't see these signs on a single-stall bathroom, say something to them. I see it all the time. And most people are very nice and receptive. So anyway, if you want to be an activist today, go do that. So next I want to look at the need for conversion therapy bans. So there's a growing body of research documenting the need for bans on conversion therapy practiced by licensed healthcare professionals. And this research is really bolstered by the position of all major medical associations that have come out against conversion therapy, saying that it's a very harmful and ineffective practice. Despite sort of this body of research, this is a pretty new area in terms of legal change and regulation. So California, this is data from our study that was done last year at the Williams Institute, and we found that nearly 700,000 adults had undergone conversion therapy at some point in their lives. Half of them had received it as adolescents. It's shocking. A lot of people, even when we put this, we were talking about this study, many people said, well, it's not still happening. These are adults you looked at. They're up to age 59. This is decades old. People aren't doing it anymore. But we actually looked at the younger cohort in our study and found that they too had similar rates of conversion therapy. And using that data from just 18 to 24-year-olds, we were able to estimate that 20,000 people currently between the ages of 13 and 17 will have conversion therapy by a licensed healthcare professional in the U.S. before they turn 18. We found that bans were protecting a lot of kids. About 6,000 LGBT kids lived in states that had already banned the practice by licensed healthcare professionals. Since then, 6 states have passed similar laws, so this has thankfully dropped, but it is way too high. We also know, of course, that conversion therapy is practiced by religious and spiritual advisors. A lot more kids actually get it from that source. I didn't include it because of the context we're in today, but other research has found serious health impacts of conversion therapy, including increased levels of anxiety, depression, low self-esteem, and increased suicidality. So California banned conversion therapy by licensed healthcare providers back in 2012, specifically the practice on youth. And last year, a bill was introduced that would have expanded this law to basically prohibit conversion therapy on anyone in exchange for payment. That bill was ultimately withdrawn, but we might see another version of it introduced this year. So since California was the first state to do this in 2012, 14 other states in DC have followed our state's lead in passing these bans. We expect that number to grow. We also expect the challenges to these laws to grow too, unfortunately. So next I want to look at the need for suicide prevention policies for LGBT youth. So this is data from the Youth Risk Behavior Surveillance Survey, often called the YRBS. I'm sure many of you are familiar with it. This is data specific to California. So again, even though California has great laws and policies in place for LGBT people, we see LGBT kids being much more likely to report suicidal ideation and related behavior in California. You might say, well, of all of California, Los Angeles has an even better legal and policy landscape, which would be true. But we're seeing high rates, too, of LGBT kids reporting suicidal ideation and related behaviors here. This is a huge problem. So California has done a lot to expand laws and policies that aim to prevent or reduce youth suicide. And so one law that passed in 2016 requires schools to develop suicide prevention policies that address the needs of high-risk kids, and that law specifically designates LGBT kids as a high-risk group, which is really important because it ensures that people are not only aware that they're a high-risk group, but are taking steps to consider this population as they develop and implement these policies. So we also know that there's a need for supporting LGBTQ youth in foster care. This is a survey done by the Williams Institute and other LA-based organizations that specifically looked at LGBTQ foster youth in LA, over 60% of whom were female. You can see there that youth in foster care were much more likely to identify as LGBTQ youth than youth in the general population. We also know from that study that very high rates of LGBTQ youth report experiencing discrimination based on their sexual orientation or gender identity. 30% of those who were 12 to 16 years old, and 46% of those, or 29, I guess, 30%, and 46% of those who were 17 to 21. You even see there that many non-LGBTQ kids were reporting experiencing discrimination based on perceived sexual orientation or gender identity. And a lot of these kids had actually been kicked out of their homes or ran away because their parents were unaccepting of them being LGBTQ. So you can see there 12% of those 17 to 21 reported that they'd had that experience. So California, just last year, passed a law that basically requires the State Department of Social Services and other agencies to come up with a plan to ensure that foster youth in California have access to gender-affirming care. The bill is really great. I suggest that you read it if you're interested in this space, if you haven't yet. It really does a lot to say this is exactly what has to be done. This is how we need to make sure these kids are getting cared. This is what the care looks like. So it's a really great law that we have in place for foster youth here. Finally, I want to look at the needs of LGBT older adults, another particularly vulnerable subpopulation of LGBT people. So this is data that we have actually by sex, so we're able to look at lesbian and bisexual women in California. This is just data, and we see that about 70,000 women in California over the age of 65 are lesbian or bisexual. We also see that they're having a lot of trouble in different areas. 28% report that their health is just fair or is poor. 50% of them are living with a disability. 30% live alone, and many delayed or did not get medical care in the past year, and some report that they have no usual place to go when they're sick or need health advice. So last year, California passed a bill that adds LGBT people to the list of older adults with greatest needs due to social and cultural isolation. So this, again, is another law that really looks at getting services and care to people who need it most. this time older adults. We also know, oh, sorry, my percentages aren't showing up there either. We also know that LGBT people have trouble in long-term care facilities. This was a study done back in 2015 nationwide where many LGBT people and a significant percentage of non-LGBT people think that it's safe to not be out as LGBT in a long-term care facility. So we also see that LGBT people in that survey reported actually experiencing different forms of discrimination in long-term care, including harassment from other residents and harassment even from people who work there, restrictions on visitors, and other problems. So back in 2017, California passed the LGBT Long-Term Care Bill of Rights that protects LGBT people living in long-term care facilities from discrimination based on their sexual orientation and gender identity. And again, does a really great job laying out exactly what is required, what you are supposed to do if another resident complains about someone's sexual orientation or identity, if you're witnessing discrimination from other residents or staff. And the first law of its kind. So I only have a few minutes next. So I'll go through this very quickly. What are we expecting in the future? The Equality Act would be a federal law that would prohibit discrimination based on sexual orientation and gender identity in a range of settings, including public accommodations, employment, education, housing, other areas. That's going to be introduced tomorrow, we think. So it probably won't pass, but it's going to be there. Congress will consider it. So, and 3 bills have already been introduced in California that would support LGBT people's health, including a Safe and Supportive Schools Act that gives teachers the tools and training they need to better support LGBTQ kids, an intersex autonomy bill, which requires informed consent before surgery is performed on intersex babies or minors. And then there's a bill that would create a grant program to support nonprofit organizations helping youth who experience homelessness, and grantees under that law would be required to provide services specifically to LGBTQ youth. Thank you. I think I used all my time up talking, but I'm happy to stay during the break if people want to ask questions. Oh, sure, I can do questions up here too. I can send them to you for sure, yeah. Or maybe I can make them available and you all can share them? Yeah, definitely. Yeah, so this is a great question. It'll probably take a minute. This is a question about how discrimination is measured in these surveys. That's a great question. That is something we are trying to improve all the time. Discrimination is subjective, yes. This is asking people to self-report experiences of discrimination. It's really hard to understand what legal discrimination is. I'm a lawyer who studies employment discrimination. It's hard for me to track it. A court might say this is not discrimination. There's not enough evidence of discrimination. It's not the right type of evidence. It's not actually discrimination how we think of it. So this is really hard. But yes, overall, these are self-reports of discrimination. Oftentimes, I've sort of shorthanded it in a lot of ways here and used the term discrimination because that's what the studies were trying to get at. But a lot of people don't know how to answer that question because they think they don't know what that word means, or is it a legal word and they're not quite sure. Does that mean they've actually had a case adjudicated and discrimination was found? So often you'll see like poor or unfair treatment. But again, we don't know. This is not, all of this data has not been validated by a court.
So I'm curious about kind of any research that's been done in terms of LGBT perception of discrimination in obstetric settings.
That I don't have data on that. If we find anything, we'll definitely send it.
Thank you.
Mm-hmm.
Hi, my name is Loretta Worthington. I was wondering, just a clarifying question, when you're talking about LGBT as it pertains to women, are you talking about people who are assigned female at birth and who are now transitioned and living as male, or are you talking about transgender women?
That's a great question. So on the Gallup question, when I talk about LGBT women, That is people who said they are LGBT and they are also women. We expect those to be transgender people who identify currently as a woman. That said, the question's again not a perfect one. We don't recommend that question for data collection on transgender people. We actually recommend, if anyone's thinking about data collection, a two-step approach, which asks people what the sex was on their original birth certificate when they were born, and then what sex they are now. That's a better way to measure that. Unfortunately, Gallup doesn't do that, but we are working towards better data collections with Gallup.
So a follow-up question, when you're talking about, earlier you're talking about the Gallup survey and how they lumped LGBT together, and you're going to advocate for them to tease out that question a little better. Will you be advocating for the addition of a Q, since a lot of folks who are non-binary or genderqueer or identify outside of the LGBT?
Yeah, that's a great question too. Of course, we know we're missing a lot of people. I'm glad you brought that point up. I should have mentioned that. We're missing a lot of people who don't think LGBT, the label fits them, so they might have answered not sure or don't know. We haven't advocated for that, no. I mean, to be quite frank, it costs money to get questions on a Gallup survey. It costs money to have them change their policies, to test them, to actually implement them. We haven't done that yet. We're really trying to drill down right now on the trans population and figure out again what their gender identity is and how to separate them out from the LGBT population. There may be an opportunity to sort of follow up on those people in terms of their exact identity under that transgender label, but it's hard. It's hard, and maybe in the future.
Hello, this is Diane. I am Diane Gaspard, and I work with the WIC program. And recently, we will, in the near future, start asking gender preference. We never used to do that before, and there's like 11 categories, or they can choose not to disclose. And so I wanted to know, in terms of research, how having all these categories can help use this information so that we can frame it for the staff.
Yeah, that's really interesting. So, of course, being an organization that studies data, we're always advocating for better data and more precise data. I know that perhaps you based the question on this, but the U.S. Transgender Survey that I talked about before asked people many categories of gender identity. And that data has been really important because oftentimes we talk about, again, transgender people using this umbrella term that maybe doesn't fit for everyone. So, for example, California has moved, and several other states now, towards allowing people to put a third option gender marker on their paperwork. So maybe that would be something you could use it for. But saying people are transgender doesn't really get at that deep, because we know that many transgender people are transgender and also want a female or male gender marker on their identity documents. But there's a group who might say I'm transgender, but they want a gender neutral marker. So again, it's about measuring that population and meeting the needs that might not be the same as people who are transgender and also male or female.
And then I just wanted you to quickly summarize what the outcome of the Price Waterhouse. I wasn't really sure.
Sure, yeah. So the Supreme Court, so they were dealing with a law like the ACA non-discrimination provision that prohibited discrimination based on sex in employment. And so for a long time that was thought to be, well, if you're male or female, you're discriminated against. That's because of so this case, the Supreme Court said, no, it's actually a little bit broader than that. And the law also prohibits discrimination based on one's failure to conform with gender stereotypes. So if I went into my work wearing this today and my employer said, no, women can't wear pants, that's not feminine enough, you look like a man, you're walking like a man, that would be sex discrimination. Because it's about how feminine they think I'm acting and whether I'm acting feminine enough to meet their standards of what they think a woman is.
I'm a public health nurse. I work in the district nursing, and I have a quick question about confidentiality with this. So an example of what recently happened to one of my coworkers is we received a referral, and followed up on it, followed up based on the referral, which indicated, I believe, the person was a female. When she started doing the interview, kept asking questions, and the person was really answering really vaguely, finally said, look, I'm going through transition. So, so really wasn't, I believe, female was transitioning. So whatever the situation was, bottom line, we weren't told. So into going into the interview, we're going based on that assumption. And so, and fortunately, it worked out okay. The patient and was okay after the explanation. But there's some instances where some people are really touchy, upset, could react that way. And so I don't know if there's anything in place for that as far as because of the information, medical information being confidential, so certain things aren't being disclosed. It puts us in an odd situation sometimes in having to deal with that.
Yeah, that's a great question. It's not something I have expertise on. The next panel might be better for you I wish I could answer that. I don't know, and I don't want to say the wrong thing. But I mean, it sounds like it worked out okay in that situation, but definitely a concern. So there's a question about HIV discrimination and those who've been discriminated against who are actually in care. I don't know that off the top of my head. For the person who asked that, was from the Lambda Legal Survey done in 2010 about experiences of discrimination in healthcare. There might be someone from Lambda here who may be able to answer, or check that out on the web. I'm sure they'd be able to help you. So on the race data, how accurate do we think it is? Because many cultures or races may not disclose due to shame or stigma. Yeah, that's a great question and something that we battle with too, and an important caveat that we just don't actually know about LGBT people as a whole because of different questions that people might not want to answer, either if they've already said they're LGBT or if they just don't want to answer the LGBT question. We don't know. We do know, though, that question doesn't cause a significant drop-off in the surveys. People are willing to actually answer that, especially when they're ensured that the responses will be kept confidential. So it's not like people get that question and just stop answering, and that applies to people of all races, at least the race categories that we have here. So what are the current changes and challenges with LGBT rights? So just to sort of highlight one major one, and this kind of goes to the ACA law that we were talking about, but I was sort of very focused on that law and that provision today. But there is an effort administration-wide to interpret sex to narrowly mean biological sex. Again, this would overturn many different agency policies that were in place during the Obama administration or even before that were moving to that broader understanding of what sex means. So that's not going to only affect people who are, bringing a claim for healthcare discrimination, but also in employment and in sort of access to restrooms where policies have been expanded for people. So that's a very dangerous thing that we expect to see coming pretty soon. And of course, an expansion of these rights for religious objectors, those who don't want to provide care or services or other types of things because of their religious or moral objection, of course, not only to LGBT people, but we're also seeing it in the context of abortion as well. That's it. I'll be around after this if people want to come talk. Thank you.